Welcome back to StartUpHealth TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. It's my pleasure to be here with my guest here, Chris Turner, CEO and co-founder at HealthBook Plus. Chris, great to see you.
Hey Logan, great to see you. Happy to be here.
I love what you're doing around, collecting patient data and making it more actionable, because you are collecting some sort of non-traditional data and saying there's a lot of aspects of a person's life that kind of contribute to the picture of their health. So sort of tell me more about that and kind of what you're building at HealthBook Plus.
No, thanks Logan. So what we've built at HealthBook Plus is a platform to help people own their health by leveraging data and AI. And the data perspective is a little non-traditional. So we bring in electronic health record data,
Sure.
Okay, that's pretty common. Claims data, that's pretty common. We also bring in wearable, remote patient monitoring, smart device data, so sleep, biometric, exercise data, O2 saturation, things like that. But then we add in different components like socioeconomic data.
Okay.
So it's really pretty amazing how we can build models off of socioeconomic data, how an individual spends their money, and then can really identify if there's a future health trend that might be coming up, and then alert those folks so that then they get early help and better outcomes.
Give me an example of how something that I'm spending my money on or just my socioeconomic picture is going to contribute to my health picture.
So I'd like to make it really simple. It's super complex. It doesn't take just one parameter.
Yeah.
But just to give you an example, we've been able to identify that most people that quit paying their cell phone bill have some type of a mental health challenge.
Okay.
And like I said, it takes in much more parameters than that,
Yeah.
but to make it simple so people can understand, it'd be things like that.
But there are simple points of data that you can gather, and when you add them all up, you start to get a better picture than if you were just looking at your claims data.
Exactly.
Just your EHR.
That's right. Or even if people don't have access to that data, they can at least start with this foundational data set that we can grab on anyone.
Okay. How'd you get into this?
So it's crazy. I spent a long time in digital health with companies like HealthGrades and eVariant, where we helped health systems use all different data sources to identify people in their primary and secondary service area
All right.
of the hospital system, and then drive them in for a particular condition. So if a hospital was trying to increase their, say, total knee replacements, we would identify the people most at risk based on data sets in their population and message them and have them come into the hospital.
I imagine that your product would appeal to consumers, so I want to sort of know and own my patient picture, my data, but also for employers and payers. So kind of what's your go-to-market strategy?
So our go-to-market strategy is three-pronged. We have payer, providers, and large employers. But those sales cycles are 18 months to 24 months.
Yeah.
So we're working them, but we also have to have some more immediate traction. So we've added in smaller employers, as well as clinics and direct primary care physicians as well to use with their patients.
Okay.
So we can get some early traction.
Is this more of like an API model or like a full service platform situation?
Yeah, so we're a full service platform, but we're just getting ready to launch late November, early December, our API Health Hub.
Nice.
And the point there is, so we have the individual at the center, and then we have AI that helps direct these people to their next best health action. But wouldn't it be cool if we could connect the really amazing point solutions like we have here at Health Today onto a platform so that people can now get access to the right component that they need at the right time?
Yeah. When you're at a conference like Health, you feel like there's a lot of companies who are saying, we're going to take all your data in sort of a nebulous way. We take all the data and we deliver it to you so you can be healthy. It's sort of like, vague sort of thing. Are you finding it to be a crowded market in terms of differentiation and kind of explaining how you're unique in that field?
I don't think it's very difficult, because what we do different is we provide insights.
Okay.
We love
Tell
the
me about
fact that everybody's collecting data.
Yeah.
So then that way then we could build models on it and give people insights and actions to do with the data and what the data is telling us.
Talk to me about those insights. How are they delivered? What types of insights do you deliver?
Yeah, so it's really tricky. So we've got a couple different AI-driven engines that sit on top of the data. The first one's a preventative engine.
Okay.
And so that would be identifying things like you might have depression later this week, all the way up to cancer several decades later.
Okay.
And you can imagine the tricky part is the messaging, because people don't want to go on to a healthcare application and go, oh, gee, I want to find out if I'm going to be sick.
Yeah.
So our platform really messages people in a very kind and gentle way, but first asks even if they want to know.
Okay.
And then if they want to know, then we can help them understand at what level it is that we've been able to identify an issue, and then send them to the right place to seek additional information or care.
Okay, so that's the value for the patient. What's in it for an employer?
Yeah, perfect. I'm glad you asked. It's really There's the ROI and the VOI. The ROI is the hard metrics of reducing the medical loss ratio, reducing their overall costs they're spending on employee health. But really the VOI is what most important to most employers, and that's that value on investment. So employees are showing up at work, they're more present at work, they're able to get their job done, less unplanned leave, things like that.
I know you're relatively early in your journey. What's it going to look like to validate some of those measures, ROI, VOI?
Yeah, so we've got 10 customers right now, and they're really awesome in the fact that they're stacking hands with us to measure the outcomes of what the platform's doing. So we've got a couple customers that our goal is to just reduce that overall cost, and if we can reduce it by 1%, it's a big win.
Yeah.
And then if we can reduce unplanned leave by like 5%, huge win.
Nice. I'm guessing partnerships are a huge piece of what your growth looks like. So if there's one message that a potential partner watching this would hear, what would you want to tell them?
That we're a platform that if you're additive and you can not only just send us data, but also take data from us so we can make a more personalized journey, we'd love to talk to you. The other thing is we're backed by some really amazing angels, and they want us to look for some of these point solutions that might be struggling or running out of capital. They did a big raise in 20 or 21 and might need a partner to keep floating. So we'd love to talk to those folks too.
So you may be looking for M&A? Or?
Absolutely.
Okay. So you are gathering the data, you're creating these insights, but there's other sorts of point solutions that you could be bringing into the fold.
Exactly.
Interesting. Well, we'll make sure that message gets out. Chris, love getting these updates from you. I hope it's an awesome end of 2023 as you figure out this API model, and I think you're going to bring a lot of help to folks.
Cool. Thanks, Logan. Appreciate it.
Chris.